All right, so we're going to talk about what we do when we assess the TMJ joint, and the TMD, the dysfunction that may be going on. So one of the things that we really want to determine at the very beginning is whether this is an actual joint problem, what we would say is intracapsular, or extracapsular, meaning is this a soft tissue problem that is leading to a dysfunction, right? So one of the first things that we're going to have Ryan do is we're just going to have him open up his jaw as wide as he can. And I want you to get in here close. Good. And open again. And all we're looking for, is there any deviation? Is there a lateral sway? Is it coming back? Do we get clicking and popping? So we'll feel for that. Those are all things or signs that would indicate that we have a TMD, temporomandibular dysfunction. Okay, so we assess that, we get some baselines, we figure out what way it's going, we see if he's having any pain with doing any of that stuff. Then we're going to get in here, and so I'm just going to have Ryan just slightly open that jaw, and I'm just going to, it's a pretty firm contact right here. And all I'm doing is scooping and just kind of testing that joint. And so what I'm going to say to him, does that replicate any of the symptoms that you feel on a regular basis? And if his answer is no, then we know it's not really in that joint. And if his answer is yes, then we got to start exploring, or if his answer is no, then we know it's not really in that joint, and we got to explore some of the soft tissue. If his answer is yes, then that's an indication that it's the joint, and we got to do some rehab with that, right? So for this sake, let's say he said, no, I didn't get anything. So next, we are going to feel the muscles. So we're going to feel his masseter muscle right here, and we can feel on both sides and see if we feel any trigger points. And also if there's anything that causes tenderness. I feel a little trigger point on the right for Ryan. He might not even feel any symptoms. Do you feel symptoms?
No symptoms.
No symptoms. But there's just a little, a nodule of muscle. Then we kind of work our way up into the temporalis muscle. We usually get some trigger points along this side of, either side of the ear up to the eye, basically. And then we'll kind of feel up even a little bit higher. So if we find a trigger point, all we're going to do is we're going to do some sort of soft tissue. It could be just digging our thumb in here and just kind of working through that tissue. And so he's getting a little referral. It's not great, I'm sure. But then basically, then we have him go back to our baseline, retest his opening and closing. Are symptoms better or worse? Are we getting any better deviation or any better clicking and popping, right? So that's what we would do soft tissue wise, right? Always when we do soft tissue, we always also want to train those muscles that we worked on. So in that instance, if we're training some of the muscles, we're going to train his ability open. So he's going to push the tongue to the roof of his mouth and open nice and slow, as wide as he can, until that tongue tries to lift off. Then he comes back up, pushes tongue. And this is one of the great exercises that will help train those muscles to open evenly. Okay. So if you've been treated by us with TMD, we use that exercise quite a bit. So now, let's say it was intracapsular. It was part of the joint. He had pain or symptoms were reproduced when we did this test. So then what we're going to do is we are going to try to retrain that joint pattern. So one of the most common ways that we are going to have people work through is protruding their jaw or lifting it straight towards the ceiling, just the lower part of that mandible. And all this does is start to retrain the joint in here and the disc that we're doing. And then we can progress that where he goes up, and then he's going to slam open. And he's going to reset, up, slam open. So this is something that we would do. Again, after we get that joint moving better, we check symptoms to make sure the deviation or clicking, popping, pain is a little better. If it's yes, it is, that's something that we're going to send home. We always then do some more rehab at the end. So again, we would probably do the tongue to the roof of the mouth, open up the jaw. Good. So this is just a little bit of what we are looking at and how we're assessing and treating a jaw.